Hi, I'm Councillor Susan Masters, and you'll be able to hear more from me on the True Ambassadors talk show coming up very soon.
Greetings to everyone. Welcome to our talk show, True Ambassadors Talk Show, being sponsored by CLMD. And today we have a special guest. Councillor Susan is here with us. We are also having the opportunity to have AJ, the CEO of PLMD. Thank you so much, sir, and for all you've been doing for us. We are indeed grateful. And thank you for standing by us on this. We are really grateful, and we're going bigger and bigger, as you can see. So, Councillor, thank you so much for coming, for honoring us. It's a privilege to have you here today. As a young charity, we are trying to expand our grant through different platforms to reach to people. And as we know, you are a chair for the Scrutiny Commission of Health and Social Care. And we would like to ask you a few questions regarding the job you've done, because most people do not know what is Scrutiny Commission is. For me, if I didn't meet you in that event, probably I wouldn't have gone to do some research about the work, what scrutiny means, what's the job these councillors are doing. Because sometimes I've had the opportunity to have few councillors in my events, but I don't really actually know what they do at the background. And not because they don't do their jobs, but because I haven't taken my time to do some research about what is this. But meeting you at that event last week actually gave me a broader time to really think and do a lot of research about what do Councillor Susan do in the community. So it will be a pleasure to have you here. So if you can introduce yourself to our viewers before we start asking you questions.
Hi, so as you've so warmly welcomed me, I'm Councillor Susan Masters. I've been a councillor for the last 10 years. I became a councillor because I was absolutely passionate about Newham. I moved to East Ham in 1990 and just totally fell in love with my borough. At the time, I was working in the media, but after the 2010 recession, opportunities in TV or the kind of television I was involved in working at the time lessened, and I started volunteering in my community. I was involved with a charity called Clean Up UK and did a lot of litter picking. If you look at the area around UEL, ironically in Cyprus, we did a lot of work getting litter removed from there. There used to be some horrible prickly bushes that used to attract a lot of litter, and we got them removed, and it sort of put to grass, so you don't have that same problem. And I was also sort of involved in my local community forum that put on events, for the free events for the public.
Wow.
I was involved in a residents association locally where we tackled local issues like potholes. And I joined the Labour Party around 2011. Ed Miliband was the leader at the time, and I'd known him bizarrely when we were both teenagers, because we both used to do a radio show for LBC called Young London.
Wow.
And I thought, well, you know, I know Ed's a decent chap. My politics have always been sort of left of centre. So joined the Labour Party locally, and my degree was politics, philosophy and economics, and I'd always thought that councillors, you know, they're always portrayed as being elderly white men, sort of with chains on, who just sit and don't do very much. And I found out that there were a lot of really brilliant things that our council were doing, like the landlord licensing scheme, which meant that if landlords weren't doing their repairs or if tenants were responsible for antisocial behaviour, it gave the council a tool with which they could sort of put those problems right. So I ran for office in 2014, got elected. I'd always had an interest in health policy. Around 2011, I was involved in the setting up of an organisation called Newham NHS, which came about because of the Health and Social Care Act. So we did campaigning sort of against a lot of the terms of that, and trying to make it democratic, trying to sort of keep the NHS sort of accountable. So when I got on the council, I expressed my interest in joining Health Scrutiny. Now, a council's divided into two halves. We have a mayoral system in Newham, so most decisions stop with the mayor. The mayor works with a cabinet of people who lead various sort of departments and can make sure that what those departments are doing tie in with the manifesto that we stood on. Outside of cabinet, you have councillors who we're referred to as backbenchers. So we don't have a cabinet position. However, we can scrutinise what the cabinet are doing. So, and if you're talking about health scrutiny, it's not just the council. You can look at the council, you can sort of ask questions about social care, but we also are the one scrutiny that every council has to deliver, and we have powers to summon people from the wider health system. So we can summon people to talk about primary care in terms of the way doctors are organised and people are accessing services. We can organise the leaders of our integrated care system that sets strategy right across the system. We have the Chief Officer for Newham Hospital attend regularly. So he'll talk about the challenges that they're facing. And we can summon the East London Foundation Trust to deliver mental health services in the borough and talk to them about how they're trying to make mental health services more accessible and more sort of representative of our community.
Wow, it's an amazing job you guys do, you know. It is good to have you on board to actually hear this, and for our viewers, it's really going to go a long way. So before I ask you the next question, I'm just going to give it to Abe, our event manager and PA. So Abe, please, can you ask our Honourable Councillor your first question?
Thank you so much for coming today, Councillor Susan Masters. So the first question I'm going to ask you is, can you please tell us about the recent report on the health impact of population growth in Newham, and what are the key findings and recommendations?
Right, there are 22 recommendations, rather a lot. What it was about was I'd noticed in a strategy document that our integrated care system had produced that there were going to be another 110,000 people moving into Newham in the years between 2020 and 2040. And I just felt that was going to put an incredible strain on our system. So my commission spent a year, each meeting, so we have about, between 4 and 5 meetings in a year. So each meeting we looked at a different part of the system, and we got people to come and talk to us about how they were trying to address this challenge. So firstly, we had to find out how genuine this challenge was and whether the numbers that were coming into Newham were actually sort of reflecting this 110,000 people, because with inflation in building costs, that's slowed down some of those developments, but it's still going to be a problem. And the other aspect that worried us is we always hear about Newham being a very young borough, which it is. But one of the things we noticed was that the group of residents that was going to see biggest growth were the over 60s. So it was just wondering whether the council was taking that balance on board. So we invited our social care team and public health team, and they were talking to us about the work they're doing around ageing well, where they are reaching out to over 50s and trying to make sure they're thinking about the levels of exercise, the kind of food they're eating, and just making sure that there are plenty of opportunities for them to sort of stay in better health, but also sort of form connections. So that was part of it. We did a lot about data. We asked a lot of questions about integration because we keep being told this will be a solution. And yet what we found was that there didn't seem to be a clear idea about what these integrated services would look like. And this is about services working more closely, like, say, for example, if somebody's in hospital, it's really important that the hospital team are working very closely with social care, or in our case with Age UK, to make sure that when they come home to a home that's warm, where if they suffer from mobility issues, that they've got like food there and somebody's keeping an eye on them. So it's that kind of thing. It's making sure that services are joined up. So if someone's going to their GP a lot, say, but their problem isn't really medical, it's that they're lonely. Because loneliness, I think they did some survey that was saying that loneliness was like smoking a really large number of cigarettes a day in terms of its impact upon your health.
Yeah.
So there's now a role within GP surgeries called a social prescriber, where when they realise that a lot of the pressures on someone's mental or physical health come down to worries about financial problems, say, they can refer them on to a service like our Newham Money, which can help them sort out and take back control over their finances. So we looked at that. I did actually come in for a list of my recommendations because there are so many. There were questions to the wider system, because these days a lot is decided at a North East London level. So we felt that there should be a lot more work around looking at funding formulas to make sure that Newham was properly recognised, because a lot of the time that's based upon just age. So if you've got more older people, you'll get more money. And we were saying, well, in Newham, you've got a lot of poverty. And that should actually be what decides how people get funded and sort of inequalities. So we talked about that. We're worried that we're not going to have enough beds in our hospitals. So that was a really big thing, because at the moment the only talk about refurbishment is at Whipps Cross, and that's not even going to start till 2035, and it will actually see a reduction in beds, not an increase in beds. We wanted to see our pharmacies properly reimbursed, because they're the organisations on the ground that deal with our residents day to day. And we felt it was really important that more was being done with those relationships, because people know the people who work in their chemists, and when they start feeling a bit off, those are the people they can speak to. And it's a lot easier to have a conversation with your chemist than it is to get a doctor's appointment. And it may be that there's a very simple solution to your issues. So we talked about that. We heard about a lot of the work our housing team was doing around elderly people in social housing, but we felt there was a need to reach out to and form links with older people in the private housing sector as well, because there are a lot of older homeowners who may not have family. So just maybe using something like the landlord licensing thing or other methods to reach out to make sure that we're in touch with them, and that their homes are sort of still up to scratch, and that they're still able to live comfortably in their housing. We were worried about a lot of the new jobs that were coming into primary care around doctor surgeries that had quite confused names, and we felt a lot more work should be done within surgery, so that when you walk in, you can actually see what those roles are and what those people do. We wanted more money put into prevention as well, to make sure that people don't develop serious health conditions, because it's more pleasant for a resident to actually not have a long-term condition, but it's also sort of cheaper, rather than having to sort of sort out that condition further down the line, and it's a lot harder to do. And also sort of having more room for the patient voice and co-design in terms of the way we're sort of building our services. And also supporting a local council for voluntary services, which is what One Newham is doing at the moment, but sort of expanding that, because in some boroughs like Hackney, they've got very long established councils for voluntary service that offer training to new organisations, because Newham is a community that's in perpetual flux. You've always got new communities coming into Newham, but it's it's understanding the barriers those communities are facing, and also helping them navigate our services, which are not always the simplest to engage with. So that's a kind of overview of all our recommendations. And it was quite exciting because it was the first time when we had a joined up response, because generally what would happen is I would then have an off the record conversation with all the different parts of the health system about what they thought about our report, how they felt about our recommendations, and how they would take them forward. Whereas this time, and we would go to a cabinet meeting and we would be asked questions by cabinet, and then they would accept our report, or they would say, well, actually, we can't accept that bit. But this time, for the first time, I got a response to all my recommendations from the cabinet.
Wow, that's amazing. Thank you so much for telling us this in details. And it's a recap. You really touched a lot of inquisitive that we are trying to say what Scrutiny is doing, and you are really going into it. Thank you. So please, can we take the next question?
Okay, so the next question is, how is the Health and Adult Social Care Scrutiny Commission addressing the challenges posed by the projected growth of 110 residents between 2020 and 2040?
That's the report I've just talked about.
Oh, you mentioned
yes, meeting Newham's future needs.
Good. So we can go to the next question. Yep.
Yeah.
So the next one is, what strategies are being implemented to meet the increasing health and care needs of Newham aging population?
That is what some of the things I just talked about as well. It's the Aging Well strategy, where we're providing a lot of activities to keep people healthy, to bring people together, to sort of keep networks going. We've got some social workers sort of based within the community who, if people are sort of struggling for their mobility, they'll speak to them about what their interests are and try and make sure that they're kept joined up to what's going on in the community. They're kept sort of posted on where they can go to actually sort of find those activities. So that's the kind of work we're doing. It's a mixture of sort of prevention to try and keep people mobile for as long as possible, and also keeping people in their homes for as long as possible. And in terms of that new homes we're building, try and create homes that can be used by people throughout their life, so that are more energy efficient, but have things like wider doorways, so that if someone needs a wheelchair further down the line, they can sort of access it, so that the bathroom can be transformed into a wet room, say, if need be. So it's those kind of ideas.
Thank you so much for that, for that question, for answering it for us. We are really grateful, because you're really you are enlightening us on. And this will enable us to do our work more, because we are beginning to understand what the commission does and how they work. So as a charity, and independent charity, is going to actually help us to do our work in a more dignified way. But we know that there are people behind that are also doing the background work, trying to make sure these jobs are being delivered to the community. Thank you. So please.
Yeah, so the next one, as I think you've made some point about it already, but what are the changes made to health scrutiny?
You'd speak to Health Watch, who are the body that tracks patient experience across Newham. You'd speak to somebody from primary care about the challenges doctors are seeing on the ground. And you'd probably speak to somebody from the voluntary sector, like I would speak to Joy from One Newham about what the voluntary sector organisations she's hearing from are telling her. So we would then draw up a short list of things that we wanted to look at. Because it's important as well to stress that a scrutiny committee, we look at things strategically, we look at policy overall. What we wouldn't deal with is a kind of situation where somebody might have gone to their doctors and been given a wrong prescription, or there wasn't a particular brand of pill in a chemist. Those are kind of sort of casework type issues. We deal with policy at the sort of top level, how whether services are working well for the people of Newham. So we'll look at where the problems are, and I mean the other thing I do is I'll reach out on forums like Nextdoor and just say to people, what are you seeing with our health and care services at the moment, and get them to sort of DM me if there's an area that they think we've got a problem in. So that's the way scrutiny work, that you have a work programme across the year, and that there might be a new approach to domestic violence, say, landing in April. So you will make sure that before April, you've had a session looking at what that policy is trying to do, where you ask questions and come back with recommendations. What I've brought through is this new area where you still have your set work programme for the year, but for the opening half hour, if there's been something on the news that day about something central government are doing that could have an impact on Newham, you can just ask a question about it. Anyone on my commission who's read anything in the papers that's worried them could ask a question about how that will play out in Newham. But likewise, if something has changed on the ground, people are free to sort of bring it into the meeting now and talk about what they're seeing. So it just makes health scrutiny a lot more flexible. That there might be things that can be answered with one question, so we don't need a whole item, but we just need 5 or 10 minutes to ask what's going on. Like, for example, in our next meeting's end of April, and one of the things I'm going to want to ask about is how the abolition of NHS England will impact on the ground, whether there'll be any job losses and what effect that will have, if any, or whether it is literally just a kind of changing of arrangements at a top level that's not going to have any impact.
Wow, thank you so much for that. And one question I would like to ask again is, could you please explain the concept of the integrated neighborhood team and how they improve health and care services in Newham?
Well, that's a very, very good question. That was one of the things we were trying to find out, what an integrated neighbourhood team would look like. And we emerged kind of none the wiser. I mean, it is literally just about a way in which our own doctors will be working more closely on the ground with social care, with the voluntary sector, with community level mental health services. But we came out unsure of what that will look like. So your guess is as good as mine. But I'm told that this is something that will be emerging over the next few years.
Oh.
But it is about people just working more closely together.
So what about the residents? Do they have their say in this neighborhood team, or it's just?
We think they should. In Hackney, they have actually had a neighbourhood project, which I worked on for 2 years, where each community neighbourhood area, like, in Newham, you've got Plaistow, you've got East Ham neighbourhood, you've got Stratford neighbourhood. Each neighbourhood would have a meeting quarterly, which would bring together local doctors, councillors, council officers, the voluntary sector, but equally residents who wanted to come in to talk about what they were sort of seeing on the ground. So one of our recommendations was that should definitely be happening, because you need to have the resident voice there. But it's how you do that, whether you do that through the voluntary sector and communities that represent particular communities, or whether you have an individual resident who comes in and talks about what they're seeing?
From my own perspective, I think when you invite the residents themselves in that are willing to say something, because if you use it through the voluntary sector, I, I don't think it would be more the weight we not really carry much than hearing from the residents themselves. They are concerned and they are also hearing that meeting, and everybody, all the professionals, they all will hear from the residents. I think with that, it will be more grounded to have the residents to hear those that are willing to hear their voice, to say what they are concerned about and what changes they want to see. Because when they are involved, it will make it more grounded, because then it goes from the grassroots to everybody.
I think there's a balance. I think where I've heard that work really powerfully has been in NHS board meetings when they have a patient story.
Yeah.
And you'll have a patient who will talk about their experience in treatment, what worked, what didn't. And usually it's a case where something went really, really wrong. And the impact. And when one person's telling you their experience, it really brings it to life. And that's something I really want to do with Scrutiny. But I think people get confused about when you talk about the voluntary sector, what you're talking about, because a lot of these organisations locally are made up by residents, particularly the smaller organisations. They've been started by a resident because they were concerned about something they saw in their community. So they're a resident, but they're also someone who is an expert in that particular area. And because they're doing a service in that area, they're speaking to loads more residents who are having the same experience. So they can speak from the experiences of not just their own experience, but that of many of their neighbours as well.
Many people that comes to their services, that comes there, because like our services, we have a lot of them, they come there, so they hear their issues there, what they are concerned about, what we should do, or what they think we should be doing for them. It's good, but sometimes it's good to also tell them, okay, you come to this big board, come and say it there. Because if I'm saying it for you all the time, if they will feel that maybe I'm making it up, but when you hear from the right source, from the grassroots source, I think everybody will go back again and rephrase, reflect on what that resident said. It's just like what you said, is like, that's what NHS do when they are doing their management meeting. So when they are doing their management meeting, they get everybody involved, the patients, the physio. So they talk about the patient care and see what the patient feel. This is how we're going to manage your care. What do you think about it? So it's also good. I know the voluntary sector have been set up by local residents, and as a voluntary sector, which I'm part of, I meet with the residents every day. Sometimes they tell me all their stories. But when I have opportunity to bring somebody in, I will say, okay, that story you tell me, I know I will tell them, but you just put it in your own words before I can now phrase it for you. So
it's so powerful. When we were looking at the change to the police approach to people in mental health crisis, right care, right person, we had a young man called Antonio Ferreira attend our meeting because I'd found his campaign online, Hear Me Speak. He himself had experienced mental health crisis, and when he experienced it, his psychiatrist had called the police because they were really worried that he would harm himself because he had a knife and he was having suicidal thoughts. The police arrested him. I mean, he was treated absolutely appallingly. So he came to our committee and he talked about that, and he talked about the importance of the police using people who could talk about their experiences in training. Because he was saying that what he was hearing was that the emergency services, because they never really saw the before and after of somebody's crisis, they were the people who had least understanding of what it felt like to be in that situation and how to sort of deal with it. But I agree, and I see that in my committee, because a lot of the time the papers they have to read for a meeting are strategies, you know, they're policy documents. But if I bring someone into the room who can talk about their experience, you just see them wake up and they sit up and they come out sort of really like, even though they've had like a 2-hour meeting, they kind of go, oh God, that was so interesting. And so I think it's really, really important to have that voice in the room.
Yeah, it's very important, because there was a talk show we did with I Found Me. They are in Acne. So they told us they do certain events. They bring the police in, they bring the councillors in, they bring the children in. So the children tell the police, look, this is what we are scared of. This is where we want you to stay. This is how we want you to do, because we can protect this hoolock not to do what they are doing. But if you come at certain time, at certain point, you will see them there. So which was really interesting. I say, wow, this is really nice, because they are the one actually there. So they now tell the police, this is where we want you, come and protect us here. So it will really be nice that in such meeting, the residents, those not the one that have the a voluntary setup group, no a CEO or founders, but that resident that get that benefit, the beneficiary, they will also, if they hear their voice and hear their voice, to say, okay, this is our problem, this is our issue, this is what we think, this is the best way our care, we look at our care, this is the care we should be receiving, and this is what our doctors should be doing. And they will also help to say, this is what we want to the voluntary sector to be doing for us. So it will make everything really smooth and easy, because everybody is involved. So the pathway will really be easy. And as from the politician point of view, you will also see it will be easier for you to go, because you go there to represent us, and it will be easier for you to also say, okay, this is it, this is what the resident came to the forum to say. And at the end of the day, is that you really representing the residents, standing for them. And from the voluntary sector group, they will also see that, yes, it is all about supporting those that doesn't have voice, being a voice to people that are not voice. Yeah, because I found out that some voluntary sector, they kind of look at it about themselves, about oh, we don't have the funding to do this, we don't have the funding to do that. But it's also down to the resident, the beneficiary, because you're standing as a voice for them. So that gap, everybody should be involved to see exactly how they will be able to raise them up and believe in them. You know, like the fire you talk about, he's really doing well. I've had opportunity to attend one of his events and visit him in his office. So from his experience, what he has went through, he's really doing well for himself. So that's my own point of view. That's the way I see it. So we're going to be diving into the last few questions, because the councillor has really been giving us the insight of what scrutiny is and the power of women in politics. Guys, you know, this is Women International Week, and we are celebrating this by having the honor to have the councillor here with us. Thank you so much for staying with us, Susan, Councillor Susan.
Thank you. Could you please share insights on the Commission's work regarding mental health services and addressing inequality in access to care?
Okay, so in my first year as a Scrutiny chair, we looked at inequalities more broadly, and we looked at inequalities within mental health, what those look like, what the East London Foundation Trust, who supply our mental health services in the borough, what work they're doing with different groups to try and understand better what would help, and just looking at other projects that have been done to address inequalities. We know that if you're an older black man, you're far more likely to be sectioned than people from different ethnicities. And so it's been recommended that there are more black professionals in mental health, so that people feel more comfortable approaching those services. We had an organisation called Support When It Matters, who provide support for mental health in black communities in Hackney. They came and talked to us about the work they do and about the level of stigma in the community. So we did a lot of work around that. And then this year, one of the things we really want to do is look at a pilot project in Tower Hamlets, which we think might have an impact on community mental health services, where people are able to access a facility where they're not made to feel like they're any kind of threat. It just feels like going into a normal community centre, and there'll be general activities there, but there'll also be spaces they can rest. And this is based upon an approach to mental health that was tried in Trieste in Italy, where it was so successful that they virtually abolished the need for hospital beds for people with poor mental health. They just had these centres they could go to, so if they were having a tough time on a particular day or longer term, there were places they could go. But one of the interesting questions about it is the approach to risk, because in England, you've constantly got to think about the level of risk in mental health services. Like if someone's in a mental health crisis and they break something glass, then they could be harming themselves. They could be harming other people in the vicinity. You might not want to have a kettle within reach, whereas in Italy, they view the risk as lying with the person who's in poor mental health. So it's just, if something happens, it happens and it's their responsibility. But at the same time, they're not making that person feel like a pariah within their society. So it's worked in Trieste. We don't know whether it will work in East London, but we want to look at this pilot when it happens to see how well it's working and the problems that it's addressing. So that will be our next.
So when is the pilot going to start?
Well, this is what we'd like to know. When we were putting together our work programme in July, we were told that it should easily be up and running by Christmas. So we put something in for the end of the year. So we're hoping to come in when it was up and running and we could go and visit it. They're still building the facility that it will be taking place in. So what's more likely now is that we hope we will get a briefing and also have somebody who's got experience of using these services come and talk to us about what they feel isn't right with the services at the moment and what they would like to see from the pilot, but also why the pilot will be different and what it will look like. So we're hoping to have that for the end of April, but we're still in the process of confirming that with the East London Foundation Trust.
Oh, so we hope it come as too, because I'm so inquisitive to see how it works, because it's really, I think it's really a service that is needed, is well needed. So the other question I would like to ask is, what strategy are employed to improve access to primary care service in Newham?
At the moment, as a system, and again, Scrutiny's role is to look at things and judge whether they're working. I know that there is a desire to move away from offering online appointments, because what they found was they would just all go, and there'd be people who'd be in greater need further on. And what they're bringing through in Newham within the NHS, and you might have seen this if you've been to the doctor in the last year or so, is a triage system where when you ring up, they will send you a form and you sort of fill in your symptoms, and then they could either give you an appointment very quickly, or you might wait longer, but they will get back to you within 2 days. And if you're somebody who is particularly vulnerable, you will get in very, very quickly, or you'll get a response very quickly telling you when you'll be seen. And if it's something relatively mild, you might have to wait a bit longer. That's what they're attempting to do. And then I know they're keen to have a bigger role for pharmacy. And there are some very basic health complaints that they're trying to encourage people to go to their chemist for, rather than sort of having a doctor's appointment.
What about the vulnerable, the elderly, 60 plus? Is there any priority they are giving to them?
Yes, they're supposed to be. Particularly older people who've got long-term conditions. They're meant to be checking in on those people and making sure that they're okay. I mean, if you're talking at a lower level at the moment, there are over 40s health checks that take place regularly, where they'll call people in, check your blood pressure, ask you about your smoking and other sort of habits, and checking your weight. And if you're over a certain weight, then they'll probably refer you into a weight management program if you're interested in doing that. Or if you're smoking, they can channel you into stop smoking services. So those are the kind of things that we're doing. But yes, they are meant to be sort of flagging their vulnerable patients and sort of regularly sort of checking on them.
And I have one question to ask you before Abby will ask the last question. You know, public care, they have this Newham that they've put a lot of services online that is not medical. So we have a talk show with one of the advisors, but one of our concern is for the 60 plus. How will they assess this? Because some of them, they are not digital. They don't have the digital confidence, because they might feel scared that, because a lot of services are out there, so they will not actually have the time to say, which one do I need, which one do I, it's a bit confusing for the 60 plus. So I don't know if there's anything
we did ask a question about this when we were looking at the Ageing Well strategy. We had quite a conversation about this, because this regularly comes up as an issue. There is an older people's reference group of a mix of older people in Newham who advise on the treatment of the elderly, and just as a kind of sample survey, they tried to find out from them how many of them were happy being online, could use a computer, and it was about 50%, which is probably higher, I would say, than the wider Newham population. But in terms of ones who aren't, they can go into their library. We had Newham hubs in our big libraries where you could go in and they had leaflets, or they could give you phone numbers for services locally that could help. Age UK have got offices in Newham that people can access. But generally, yes, going to your library would probably be a very good place to start in terms of getting resources. And most libraries do classes and have conversation groups for older residents. So that would be where I'd always direct somebody.
Because from my own perspective, if the libraries are doing these one-to-one, they are doing these trainings, so they have to be a way to get hold of these elderly, the seniors in the community, to make them understand that don't sit in your loneliness, come to the library, because some of them might not actually know that they have to come to the library. So they have to be a system to reach them, either through their GP or I don't know.
If somebody's in receipt of social care services, that's a very easy route. What was interesting during the pandemic was there were a lot of people we discovered who were in need. I mean, one of the things I did in the pandemic was I was one of the volunteers going out on the vans with the boxes that we were dropping to people. And the idea is that I think I can't remember whether the council picked up the ones who were in social care or not, but certainly a lot of the people we were visiting were people who weren't known social services, but clearly were really struggling to get by. So I'm hoping that through things like that, they get picked up. I mean, every now and then there'll be a discussion of an initiative of having something like street ambassadors who just have a watch on their neighbours, and where they see older people, make sure that they get information on things like bin day, where we completely changed the way, or the fact that they can have an assisted bin collection, say, things like that. Just make sure that they're aware of that information, and that they know where to go to get help. But it is a challenge, and that's why we were saying that while it's great to hear that our housing department does a lot of work around older council tenants, there are a lot of people in Newham who rent in the private sector or who are homeowners and wouldn't be part of that. So it's really important we reach them too.
Yeah, so that is a challenge, because I kind of, after that podcast, even when I listen to it, I look kind of, no, they still need to do more to make these seniors know, to say, okay, you don't sit there, go to the library. Yeah. So thank you so much for throwing a little light on that. So Abe, please, will you answer the councillor the last question?
Yeah. So the last question will be: how is the Commission working to ensure the success of the health and care space Newham project?
Right. It's not our role as a scrutiny commission to ensure the success of something. Our role would be to look at it and think, is it being successful? If it's not, why it's not? So we did look at it. I can't even remember what the context was. I think it was probably as part of meeting Newham's future needs, just because one of the issues that's come up is the lack of modern estate or surgeries for GPs in the borough, because most of our GPs are operating out of, old Victorian houses in some cases still, or 1960s buildings that aren't really fit for modern health purposes. So the idea with Health and Care Space Newham was to build new health infrastructure, because it's really hard to access money within the NHS to actually build this. So the idea was that the council would get together with East London Foundation Trust, they would put in equal amounts of money, and they would build these buildings that could then be let to GPs. But the idea was that it would be one way of bringing services closer together, so you could have social care in the same building. And also the idea was to provide some housing for key workers or for pensioners, sort of who could sort of live around it. So that was the idea with Health and Care Space Newham, but sort of ensuring that it actually delivers that. I mean, we've got the Aspire Centre now on the Barking Road opposite St Bart's, and a few GP practices have gone into that. You've got Ludwig Gutmann up the road in the Olympic Park. You've got, I'm just trying to think, what was the other one? Oh yeah, Pontoon Dock. That was the other one that's sort of been developed down in Royal Docks. But that's the idea behind it.
All right. Thank you so much for this wonderful explanation, for making us understand the importance of your work as a councillor. So thank you. We are really grateful. And the last question we would like to ask you is, I know you've told us a little brief about yourself and how you started the journey. That has been asked. So we just wanted to say the last advice to our viewers and to the people of Newham, and also women in Newham, as we are celebrating International Women's Week. What are the advice you give to the women, their resilience, how they will what do they think, how they can get into politics? Is it an open door for everybody, or
It's I just think the way you need to see politics, don't think about those people shouting at each other in Parliament. Politics is, and I get really frustrated when, because one of the things you do as a politician is go out and knock on people's doors. And it's one of the things people find most terrifying. I mean, even people within my political party, not all of them are comfortable going out and knocking on doors because they're terrified that they'll find somebody who will be really, really rude. I've only had one person swear at me in 10 years.
Wow.
And to be quite honest with that person, they closed the door before I could even respond. So I've never been felt threatened at any point. But I think it is just realising that the reality of politics is that as long as you listen to people, then people are actually quite receptive, and that politics is really just about making the world better. And I find it really depressing when I meet people who say they're not going to vote and voting changes nothing, because I've seen it make an incredible difference to people's lives. You know, people I've helped with casework where they've reached out and there's been a mistake that's been made. So just think about it as making positive change to your neighbours, to your friends, to people in your community, in day-to-day services, and reach out. You know, people are always looking for good people to come into politics.
Thank you so much. It has been amazing having you today. We don't really know how to thank you enough. We are a bit short of words, but we are really grateful to have you. And we look forward to more collaboration and do more together in the community, because we love to be a voice and to help those that doesn't have a voice. So that's one of the things we stand for, and we're looking forward to do more with you. Thank you so much. And we want to say a big thank you to everyone that have been supporting us, to all our viewers. We say thank you. And we also want to say thank you to PLMD, AJ. We say thank you for all your support and for standing by us on this. We're really grateful. What more can we say? Thank you so much, viewers, for staying by us.